Okay. Hello, I'm Ellen McGrattan. I'm director of the Heller-Hurwicz Economics Institute here at the University of Minnesota. We're very happy to be hosting Michelle Tortilt and Alessandra Foley for our another, I want to say it's almost become a series now, the economics of COVID-19. Hopefully we'll be able to move on to new topics soon enough. And hopefully soon we'll be live, in forums here at the university as opposed to on Zoom. We'll just fly people like Michelle in rather than meet on Zoom. So I've been director of the HHEI for some time now, and a lot of what we do is to try to bring, current research to public forums. So outreach events like this one is kind of a part of our mission of bringing research to the general public. And today we have, like I said, Alessandra and Michelle, who are two outstanding economists, and we're going to hear about their very latest research. And I should note that we are being recorded for those, and feel free to send on the link to friends who are interested. We're going to hear from both speakers, and then we'll reserve the last 20 minutes for Q&A. The first speaker is going to be Alessandra, who is at the Minneapolis Fed. She's a monetary advisor and assistant director of the inequality research. Graduated from Bocconi and earned her PhD at the University of Pennsylvania. Before joining Minneapolis Fed, she was also an assistant professor at NYU and here at the University of Minnesota. So a lot of what Alessandra works on is to think about social connections and how those social connections matter for macro outcomes. Do they matter? And if so, how? She's not new to the study of germs. In fact, she's our go-to person for thinking about exactly the issues such as COVID-19. So it's not a surprise that given her background, she's working on this topic now, which is so relevant for today. I'm going to turn it over now to Alessandra, and please send into the Q&A, send in questions, and we'll kind of store them as we go, and then we can bring them back up in the break. Alessandra, I turn it over to you.
Thank you, Ellen. Thank you so much for the generous introduction. And I still remember, when I was presenting to you in the conference room, the very initial sketch of, these models of germs and networks. And none of us could ever think, this will, really become relevant, so relevant at some point down the road. So thank you so much for your support and for this invitation. It's a pleasure to be here. Today I will be talking about some joint work and more in general about the relevance of our modeling technique, for answering these important questions. So as we all know, like the world has been hit by these massive health shocks, which is the COVID pandemics. And all policymakers around the world have been trying to design policies to reduce the spread of the disease with minimal economic disruption. So at the same time, all economists have been studying these issues. A lot of us have been writing papers around the clock this last year, giving a rise to a large literature on the topic. So what I would like to talk about today is what is the role of our economic models to think about, the pandemics. How can why do we need economic models? And today I would like to tell you how economic models are really essential tools to design and evaluate policies. And at the same time, also talk about which elements in an economic model may be important to incorporate in order to design smart policies. And so I'm going to talk about the role of networks specifically in economic models to study the effects of policies or infections on economic activity. And in particular, I will be talking about this particular model that is called the EcoNepi network. So first of all, why economic models? And for some reason, it's okay, let me try this. First of all, why economic models? And as I was mentioning before, policy evaluation is not easily done without an economic model. It's a very tricky thing to do. Think about evaluating policies, simply comparing, different policies and different outcomes across states. So a lot of people out there, even journalists, make statements such as, well, we observe, very restrictive policy in Minnesota. We don't observe such restrictive policy in Wisconsin. And but the outcomes of these two states in terms of infection are very similar. So can we conclude that the policies are ineffective? However, you can't really do that, because underlying there can be a lot of heterogeneity that you are not taking into account between Minnesota and Wisconsin. For example, Minnesota is more vulnerable to infections, and the reason why we observe policies is exactly because we are trying to address this underlying extra vulnerability in Minnesota. And so really you don't have the counterfactual, and you cannot conclude that policies are ineffective simply comparing the outcomes in these two states. Moreover, you cannot even evaluate policy thinking about Minnesota over time. And, sometimes people look at policy in period T, and then the outcome in period T plus 1. They see that Minnesota introduced restrictive policies and then notice that cases went down. And then they can say, well, can we conclude that policies are effective in this case because Minnesota introduced the policy and the cases are lower now? However, you really cannot, again, conclude just based on this observation over time that policies are effective, because what about the endogenous response of the individuals? It could have been that absent policies, individuals themselves, because of the fear of getting infected, may have reduced their interaction and may have taken more precautions. So it could go both ways, right? It could be that comparing across states or comparing over time these policies, you may eventually end up either over-evaluating or under-evaluating the effect of policies. The reason is that you don't have a model, you don't have a counterfactual. You don't know what would have been the case absent policies. So basically, what the model does is to provide a lab where we can run counterfactual. And that's why, economists can be useful. And it's why our work can be useful, because we can actually provide those counterfactual that are absent, in the data. So what I'm gonna also, what else is important is that we have models that somehow they simplify reality, but of course, they're not always right either. So the reliability of models depend on how well they capture relevant features of the data. So that's why we like to have quantitative models that actually can explain the data and can use the data to make quantitative conclusion. So the COVID crisis has brought to the table an exciting new generation of data. So now we're using high frequency daily data. And, we use a highly detailed geographic data and with massive coverage. Think about Google Mobility, Opportunity Insights, Safe Graphs data set. These are super detailed data sources that even use cell phones to track people and see how they interact and how the disease spread. So what I think is an essential ingredient of a model is the structure of social interaction. So basically, we know that models are needed to make policy statement, to evaluate policy under counterfactual. And we know that to be reliable, models have to capture, well the data they are intended to explain. And one of the essential feature of the data is that this, especially when we think about infectious diseases, is that these travel through the structure of networks in society, through the social interactions in society. And so for this reason, today, I'm going to show you a model in which the social interaction are at the heart of the analysis. So why the network structure? Because the network structure is really the web through which this disease, as well as economic activity, spread through the economy. So here, for example, think about the economy as a network, like a ring, where individuals are connected. But we can consider different ways in which individuals are connected. And in the left example, we have individuals connected only with the people next to them. So we call these short links. And it's a good representation, for example, of individuals connected to their neighbors or to their family, of the other family members. In the right example, we have an economy where individuals are connected to their neighbors, but also to people far distant in the network, maybe because they are having other kind of social interaction, like going to the supermarket or to the mall or to the movie. So what happens to the speed of diffusion if one of these individuals get infected in these two economies? So you can see that as time goes by, and people meet their friends, over time, in the economy on the left, there are more and more infected people, but these are all clustered around the first person that was infected. While in the economy on the right, where people don't just meet their neighbors and close family members, but they also travel around the economy for their economic interactions, there is a much faster spread that brings the disease in other parts of the city or the network. So over time, in a few days, the economy where there are long links can see the disease taking over the entire economy and the spread to be really fast and diffuse all over in a short span of time. While in the economy on the left, where people are connected only to their neighbors or close family friends, the spread of the disease is lower. So basically, this is the idea that we use in the paper, in this particular paper, to think about the spread of disease and the spread of economic activity and how to design policies that are more effective in reducing the infections without too much economic losses. So the three components of what we call the econ-epi network is the network, which is exactly the matrix of human contact. So basically, which are the connections of individuals across the network, how economic value is created along the network through this interaction, through people going to the market or to the office, and then the epi component, which is how the disease, as I just showed you, spread throughout the network and how fast that happens in different networks. So let me talk about the econ-epi network and also use this model to think about New York and how the disease spread in New York City. And we're going to use this data that I was talking about before, so highly detailed micro data, to actually capture the social structure of New York and all the interdependence of individuals that at the same time go to work, go to school, interact on public transportation. And by doing so, they generate output, but it also spread disease. And we're going to use this model. We're going to be able to run counterfactual to evaluate the impact of alternative policies, mitigation policies. As I was mentioning before, what we consider in the paper is how individuals, each single individual in New York, is connected through different layers of networks. So the same individual is connected to their households, to their family members, but also is going to be connected to their neighbors, as well as if there are kids, these kids are going to go to school, and so they'll be connected to other people around the city that are going to be in the same school district or in the same school. They're also connected through other individuals across the city because they'll be using public transportation, the metro, the school bus, and also they will be connected through the workplace. And the workplace here will be both the office as well as the store where people meet to exchange. And the key feature of contacts in each of these layers is the number of contacts you may have in each layer. So the number of contacts, of course, matter for the spread of disease. The reach, that is what I was showing before, that is the distance, whether you have short or long links in the network. The stability, which is whether you're going to meet the same people every day, or you're going to meet different people, for example, in a big mall or at the movie theater. And the weight, which is how frequently you meet these different people. So we will be capturing the difference in the speed of diffusion for different layers of the network by using these 4 characteristics. So the number of connection, the length of the connection, how often you meet the same people, and for how long you meet these people. For example, the household links are links that are stable because you always meet the same kids and the same family members. And they are also, they're stable and repeated and short. While school links, for example, are not as stable because at school you can, you have the potential to meet a lot of different kids, and every day you'll be meeting just a subset of them in the class or in the cafeteria or during, or in the gym. So basically the school links, different from the household links, have more potential for spreading because there is a higher number of people there, so degree is higher, but also more instability. So every day you'll be meeting, a different subset of kids in the school. What about the workplace? So in the workplace also you may have different kind of networks that may be more or less conducive to the spread of disease. In particular, we concentrate on the distinction between the low contact and high contact workplaces. And the low contact workplace, for example, is my research department, where we meet always the same, subset of people. We have our bubble, and we meet every day the same number of the same people. So we have stable links that are repeated every day. And so on the left we have the example of this low contact workers team, for example, a team of 3 people that meet every day and they are connected. On the right hand side, I had the diagram of a high contact sector where there are 3 people that are working, for example, in a store. And those 3 are connected, just like in the L sector, but they also meet every day different customers. So there is much more instability in this network and many more random interaction. And this will be conducive, that's basically the main idea, to much more spreading of infectious diseases. So not only we consider these 2 different sectors, so one in which you have a more random interaction and one in which you have no random interaction, but all interaction are repeated, but also we consider another layer of heterogeneity, which is important to evaluate policies. Basically, in the high contact sector, in order to evaluate output, we also consider the role of size, how much capital there is in these different establishments, and we consider 2 large groups. One in which you have a lot of capital. Think about the Madison Square Garden, large events where you have a lot of randomness, but also a lot of capital established. And this is going to be important to evaluate output when you think about shutdown. And also small establishment like your corner mom and pop store. So these, in this sector, you have more contacts, so higher degree, more unstable contacts, so more randomness, but also from the data, we see that there are lower wages. And in the health sector instead, in our research department, there is less of a difference in terms of how much capital is needed across the different sectors, but there is a substantial difference in the way people can work. For example, in the health sector, just like we're doing right now, many more workers can work remotely. So there will be the possibility of introducing mitigation policies that can reduce the infection without reducing output, because workers can actually work from home. And this is also an important factor when thinking about mitigation policies. So production during a pandemic, what happens during the pandemic is that the pandemic affects output in both sectors through 3 channels. On one hand, you have sick workers that have to quarantine and cannot work because they're sick. Some workers also get shut down by the policy. And also there will be shoppers that cannot shop because they have fear of the disease, or because the store is shut down. So there can be, in the short run, there is no possible labor reallocation across the establishment sector, and so you're going to experience a large decrease in output. The other part of the model is going to be how the disease spread across the network. And basically what happens is that there is a population that is susceptible, and there is this probability of being exposed to the disease. And from there, there is probability of getting infected, of developing symptoms, and then eventually recovering. Our innovation is that besides the probability of getting infected, we also analyze the matrix of contacts among people, so that each individual has a probability of getting infected that is linked to the interaction he has over the network. And it's not just an average probability across the economy, but it's the individual probability given the matrix of contacts. So what we do with this model that has both, the network of production and the network of infectious disease, is to study New York and use a huge data set from New York to pin down all these interactions: the health sector, the age sector, the public transportation, the number of households, the size of the household, the neighbors, and bring all these into a calibrated model in the computer. And the way we match our L and H sector is to think about sectors in which there is the H sector will be sectors in which workers have close physical proximity, but also a lot of interaction with outside customers, just like I was mentioning before. For example, accommodation and food, the restaurant, bars, the ball games, entertainment, retail, the health sectors. These are all sectors with a high physical proximity and high degree of interaction with external customers, while instead the health sector will be mostly manufacturing and the professional services, just like our own econ department. So by using this data on different sectors, we can map, the economy of New York in our model. And we look at what are the wages in the 2 sectors, what's the share of home workers. And this information is used then to see what happens when we shut down one or the other sectors. So to start the model, what we use is the Google mobility data that tells us in New York what happened between March, at the beginning of March through the beginning of April, when the economy starts shutting down. So basically what happened is that we have data for the workplace mobility, how much people were moving across workplaces, the retail mobility, as well as the residential mobility. So by assuming that in our model, the workplace mobility is captured by the L sector and the retail mobility is captured by the H sector, we can exactly map, the closing down of New York in these two sectors to our H and L. And then we assume the schools are closed while public transportation remains open. And by using these parameter values that we use to calibrate, then we can run counterfactual and generate prediction for what happens over time in the network model. So the blue line here is the network model, where after April 5th, we let the model run, and we see what the model implies for the infection in the economy. And the black line is the data, the infection in the data. And we see that, the network model is pretty good at capturing, the dynamics over time. And especially predicts a much less infection than what we call the SIR model, that is the macro model people use, where there is no assumption about networks, but each individual is assumed to have a probability of infection equal to an average in the population. So in the SIR model, everyone is the same. There is no sense of networks interaction, and everybody has an average probability of interacting with everybody else. So there is a lot of randomness, and the SIR model predicts a much more infection than in the data. So the network is a better way to model the spread of infection because it brings us closer to the data. And it can also be used to think about counterfactuals. So here I'm showing you what happens if we reopen a little bit the different sectors. So if we reopen a little bit the L sector, on the left-hand side, we see what happens to the infections. On the right-hand side, we see what happens to the GDP. Basically, reopening the L sector does not do much to the infection rate. We know these are repeated interactions that are shortly connected. And so there is not much effect on GDP, but there is a good, big effect on not much effect on infection, but a large effect on GDP. The opposite true for the H sector, where there are lots of random interaction. So by reopening the H sector, we find a huge increase in the infection diffusion and, and only some increase in output. So we can use this conclusion to design a smart mitigation. So basically we can think about, we can compare the actual policies, the blue line, with the smart mitigation, that is the red line, where we shut down less the L sector and more the H sector. And we find that in the smart mitigation, we can actually save more lives as well and save more output. So here we also, this is my last slide, we also think about reopening schools. And what happened with school is very tricky because schools are a vehicle of infections since as we were mentioning before, there is quite a bit of random interaction. But what really matters is the interplay with other possible policies. So basically here we consider reopening in August, reopening in July, and all that matters on the left diagram is that the infection really shoot up if we reopen in July. Why? Because the yellow line, which is the active cases, are still high in July. So basically, if you reopen schools when you still have, a pretty high level of infections, then the school would be, a huge engine of spreading. So the layers, just to conclude, the layers with connection that are random and unstable lead to fast spread compared to the layers that are clustered and repeated. We need to, we need models to think about policies. And I think we, using networks in our models can really improve our ability to capture the data and design policies. So these smart policies target specifically the network layers. And also there is an important lesson to be learned in terms of complementarities between different kind of policies. So basically, if you want to have a 4th of July barbecue, you may not be able to reopen schools in September. So these are my slides. Thank you very much.
Thank you, Alessandra.
Awesome.
Thank you so much. There are some questions coming up in the chat, but we'll save that for the question section. Next, I'm going to turn to Michelle, who is one of our alum who we're very proud of. Michelle started at Stanford when she left Minnesota, is now at Mannheim, University of Mannheim. Clearly, things are going well in Europe because she's winning lots of awards, Fellowship in Econometric Society, the Leibniz Prize, the impossible to pronounce, but I'll try it, Irjo Janssen Prize. And like Alessandra, I would say that Michelle's work sets her up very well for thinking about the issues we face now. She's going to be talking about social connections, family and women, and the differences in impact of shocks like COVID. And I'll turn it over to you, Michelle.
So thank you very much for having me. Thanks for the nice introduction. And yes, I want to talk about COVID-19 and gender equality in the workplace. So quite a different angle of the pandemic, but as you all know, the pandemic is affecting many different dimensions of our lives. Yes, so this is what I want to talk about. I should also say this is drawing on joint work with several different co-authors. We've been working on this agenda basically since the pandemic started in March last year, looking at this from different perspectives. So I wanted to give some credit to Titan Along, Sena Koskung, Matthias Döpke, David Cole, and also Jane Olmsted-Ramsey. So COVID-19 is killing more men than women, somewhat at least. But what I want to argue in my talk today is that the economic impact is actually larger on women than on men. And that this is really important and it matters. It matters for welfare. It matters for policy implications. It also matters for macroeconomic repercussions. So let me take a step back and show you a picture from past recessions. Past recessions, this is data from the United States going back to 1960. And what you can see here is that past recessions have been largely man sessions. So what do I mean with that? In the data, what I'm plotting here is the cyclical component of hours worked. So it's really how much do hours worked differ or vary over the business cycle. And this includes both people losing jobs, but also people working fewer hours, or in booms, working longer hours and finding new jobs. And what you can see basically is that the black spikes, so black are the men in this picture, red are the women. The black spikes, like these ones here, are more pronounced than the red spikes. So this shows that in regular business cycles, men's hours just vary a lot more. Both they go up in booms more, but also in recessions, they go down more than for the women. In fact, if you combine this, and if you want to ask the question, what share of hours worked over the business cycle is driven by men versus women, we basically find, this is the data in this table here, 3/4 or 76% of the volatility share, right? So how much hours fluctuate over the business cycle, sort of together with GDP, that 3/4 are driven by men. So in general, we have men sessions, recessions are men sessions. So, and that is not just true in the United States. So this is a picture now across many different countries. It's mostly EU countries, but we've added the United States, the UK, and also Canada here. And what I'm showing you here is the correlation of these relative hours worked. So very similar measure that I had before, but now I'm really looking at female versus male hours worked, how that correlates with GDP. So GDP as a measure of the business cycle. And I'm showing you pretty much across, these are all sort of rich countries, but across the set of rich countries, we see large and negative correlations. So meaning in recession, so whenever GDP goes down, relatively speaking, female hours worked go up. So just to reiterate, regular recessions are men session almost, everywhere. So why would it be different this time? So, yeah, there's a pandemic, but the pandemic is causing a recession. You could think the recession maybe just like, any other recession, the economic part. But there are two reasons to think this is quite different this time. On the one hand, regular recessions are concentrated in sectors in which typically men work, in which many men work, such as construction. Constructions are typical examples, but manufacturing, so these are male-dominated sectors. This time, think about what are the sectors that were most directly hit when the pandemic started, but also now that people are still cautious to travel, for example, cautious to go to restaurants, entertainment. These sectors are, very female-dominated in terms of the workforce. That's one reason, different sectors. And secondly, the school closures, right? We just learned from Alessandra, it might actually be to prevent the pandemic or reduce the spread, it's good to close schools. But there's a side effect, schools also work in some sense as a childcare facility. And, we're not just talking about school, also daycare centers, all of that by and large was at least closed in most countries at some point in time, or they're, partially closed, or at least functioning not in a very reliable fashion. So this increase in childcare needs is affecting people's parents' ability to work. And here the idea is that would affect, in fact, mothers a lot more than fathers. So why would that be the case? Let me just keep an eye on the time here. But so let me just give you just a few facts from pre-crisis data, just because I think it sets the stage to think about mechanisms and what to expect. So women do work more in high contact sectors. So, right, Alessandra was just talking about, in fact, these high contact sectors, healthcare, for example. Well, we know a large share of healthcare workers are females. So that by itself, well, I guess the healthcare sector didn't all lose their jobs. But, again, if you think about restaurants, tourism, and so forth, job loss will be just much more likely for women. Then if we're coming to the childcare issue, obviously single parents are a lot more affected than married couples with kids, just because they have no room to trade off childcare responsibilities. And in the United States, basically 20%, more than 20% of all children live with a single mom. So there's a lot of single moms who might be unable to work because of this increased childcare needs, at least temporarily. Even among those couples where both work full-time, so couples with kids where both work full-time, in pre-crisis data, mothers do 60% of childcare. So, women just do more childcare. So it seems quite likely that this unequal division would continue during the crisis. And in fact, there's a lot of data showing that happened. Two more points in terms of what one could expect in a little bit longer run. Two, maybe we can call this a silver lining, some hope for sort of gender equality in the workplace. One is that job flexibility is quite important for the distribution of childcare. So in pre-pandemic data, we found that men who can telecommute provide about 50% more childcare time compared to men who cannot. So fathers who have flexible jobs and fathers who can work from home just are much more involved with their children. And that, of course, can benefit those mothers of the same children. To the extent that we think because of, working from home has gotten a lot easier now, bosses are used to, people working random times and shifting things around or working from home. If we think some of this flexibility is here to stay, even after the pandemic has ended, then that could actually benefit working women. So this continued, to some extent, continued equal division of child care. And then last point, there is a sizable fraction of couples, it's not the majority, but there is a sizable fraction of couples that have the following constellation, namely the husband might be an office worker, so he could work from home. And the wife works in a job where she, a critical sector. Suppose she's a nurse and he is an office worker. In those constellations, if the schools are closed, quite likely the husband would take over the primary childcare, responsibility. And, and husbands who've never done this before, not to the same extent at least, that by itself could lead to changes in social norms. And in fact, so these were all sort of hypotheses based on pre-crisis data and sort of just economic logic. But indeed, we've seen the current recession has been a she-cession. So what I'm showing you here is the difference in the rise of the female and the male unemployment rate in United States recessions since Second World War. And by and large, these are negative numbers or negligible, close to zero. A large negative number means that at the peak of the recession, or at the height of the, the unemployment peak, basically, there was a large gap in the sense that male unemployment rate was higher than female ones. So for example, in the Great Recession year of 2009, at the peak, male unemployment rate was 2 percentage points higher than for women. Well, look at the very last bar here at the end, the red one. Not so this time. This is from May 2020, there was a 3 percentage point larger unemployment rate for women than for men. It's been reducing since. It's not as stark anymore, but at least for some time, there was this really stark gender gap. And in fact, this recession is continuing it's happening not just in the United States. We see this in many different countries. Again, this is the same countries I was showing you before, where regularly speaking in typical recession, we do have these man-sessions. And now basically we see she-sessions in most of these countries. We're measuring this 2 different ways. On the left picture here is relative employment. So this is showing that women are losing jobs more than men, or stop working for some reason. We're not taking a stand whether they lost the job or quit the job, but basically the reduction in employment is larger for women than for men in most of these countries. There's some exceptions. The bottom ones are exceptions. And then the right graph here is in terms of relative hours worked, right? So it doesn't necessarily need to be that you completely lost or quit a job, but there could be hours reductions, because especially if you have this childcare issue in mind, you might be reducing from full-time to part-time, for example. And we see that also. So these 2 different measures of she-session in many different countries. And then actually, let me skip this in the interest of time. Because now taking that's the data, right? So there is many different reasons to believe women would be more affected now. And then I just showed you in the data, that is indeed the case. So we could ask the question now, is a she session just in some sense the opposite of a man session, just with the signs reversed? So maybe for economically speaking, at some point, it doesn't make a difference. Yeah, men are losing jobs, women are losing jobs. At some point, we could just say the total number of job losses matters. But I want to argue here that's not quite the right way of thinking about it. There really is a qualitative difference between the behavior of women and men in terms of labor supply, and hence this matters. So men and women are not completely separate entities. In some sense, a large share of them are joined in households, and households make joint decisions. And hence the labor supply of men and women often interacts. And we know in general that women's labor supply is much more responsive to shocks and also more responsive to what the husband is doing than the other way around. So in particular, typically, if a husband loses a job, there's some elements of family insurance. The woman could be either upgrading hours or look for a job, and that kind of family insurance doesn't quite work the other way around. So that's why we want to now, and I'll very briefly show you how we're using a quantitative model to assess what this implies, and just tell you a little bit about the medium and long run possible implications and why we think this is really important to keep in mind also for policymakers. So I'm not going to go through all the details of the model. I think that would really be, I would need way too much time, and maybe you're not interested in all these details, but just to give a very brief overview. This is a model of basically many different households. Some are single women, single men, some are couples. And then they might have children. And a child here is just sort of a time need. A child needs, a time costs. Some time you need to spend with the child. And how much, that depends on whether you're in a pandemic or not. There's labor supply, which could be supplied basically part-time or full-time. There's endogenous accumulation of experience, and that is quite important because what I mean with that is if you're working full-time in particular, you might learn something and that leads to a promotion, for example. Or similarly, if you're unemployed, basically you're forgetting things, or maybe you're losing your contacts and so forth, and you're not going to find the same quality job again afterwards. And then next, we will have 2 types of occupations, and they differ by telecommutability. This is just to capture what I told you before in the data, that men who can telecommute are more involved with their own children. So we want to allow that here, that telecommuting frees up some time that you can use for childcare. The division of labor in household is partly shaped by a social norm. What I mean with that is, you know, it is true, even for the same wages, if men and women, you know, are identical in some sense, it's still the case in the data that women do more childcare. And the best way of thinking about it is that there is just sort of some social norm that, you know, maybe mothers are better suited or they enjoy it more. And hence we're putting this in by assuming there's some cost if to these couples, if the husband provides more childcare time. But not to all couples. These are going to be the traditional couples, but then we also have modern couples. For them, this is irrelevant. They just decide who does what based on financial consideration. And then we're going to look at basically 4 different states: normal times, a regular recession, a pandemic recession, and what I call the new normal, that would be the state after a pandemic recession. Let me just be very clear. This is not an infection model. A pandemic recession is just really a shock here to labor markets and childcare needs. Suddenly kids take more time because the schools are closed. So we're calibrating this model also to the data like Alessandra did, but not to New York. We're calibrating to the entire US economy, but I'm going to spare you the details of exactly how we do that. It's important. We're trying to get the returns to experience and the skill loss and unemployment rate, for example, but also the gender wage gap and the division of childcare in different couples, and of course labor supply, sort of in particular decision to work part-time for married women. And then to kind of show you what's going to happen then, we're simulating both a regular recession and a pandemic recession. And each one here by design, by assumption, will last 6 quarters. And just note the color coding, because I'm going to show you a bunch of different pictures. All the regular recessions will be in blue. The pandemic recession will be in red. And the regular recession will just be a destruction of jobs and also a reduction in the job finding rate, and be lower for women than for men. Just to capture that in a regular recession, especially manufacturing and construction jobs are destroyed, and that is hitting men more than women. In the pandemic recession, we are now assuming this job destruction and job finding rate shock is identical for men and women. So by construction, on that front, if you're ignoring the kids, men and women will now be affected identically. But then on top of that, we're putting in this childcare need shock. So kids are suddenly at home, and we're having 2 ages of kids: daycare age, so pre-K, and school age kids. And beyond school age, we don't care. The kids disappear essentially. And then on top of that, we're assuming 2 a little bit more long run changes, namely shifts in the fraction of jobs that are telecommutable and shifts in social norms. So the fraction of modern couples who don't have that utility penalty will also go up. And so I guess in the last few minutes here, maybe I have like 3 or 4 minutes, I'll show you some pictures of these simulations. So here first, I'm showing you the relative labor supply of women versus men. And in red, remember, the red is the pandemic recession, and it really falls a lot. So female employment is hit a lot more. And in a regular recession, the opposite is the case. And in fact, that is true in the data. I mean, that's the data I showed you essentially in the beginning. But this has effects. So this is not just about the employment itself. This has larger effects. Here, this picture shows you it deepens the recession. So this is basically total labor earnings. This is a measure of GDP in our model. And just the fact that the women are equally affected as men now and the childcare need shock together really deepens the recession. Married women do most of the extra childcare. Here I'm comparing fathers and mothers. So how much do they reduce hours? Yes, the fathers do a lot, even in our model, about 5 hours a week. These are weekly hours, but the mothers do a lot more. That's about 10 extra hours. They're reducing work so that they can take care of their kids. This implies a leisure gap also. So it's not just all the extra childcare time is not just coming out of work reductions. People are also consuming less leisure, spending less time, you know, doing other social activities. And the married mothers a lot more than the married fathers. And in our model, that applies then a welfare gap. So the singles, in fact, their welfare is reduced the most, then the married women and then the married men. I thought it was interesting to show, because there is some research done by psychologists trying to assess how the pandemic is affecting sort of psychological well-being. And I've seen quite a few studies that suggest the women are more affected than the men. And this could be one reason. They're literally not sleeping as much anymore, or they're reducing their leisure by more than the others because of this childcare shock. So very briefly, some short, medium run and long run implications. So one, and this has been, been talked about in policy and the wider debate for a long time, there is a gender wage gap. And what can we do about it? So here, the point is what I'm showing you here. The pandemic would widen the gender wage gap. So again, that's the red line. And I'm plotting you here, actually, the wage ratio. So over time, well, first upon impact, the gender wage ratio widens, right? It goes down. So women are making even less on the dollar than before, and it would stay wide for quite a while. So that's sort of a side effect of the pandemic. And that's partly, the women are dropping out of the workforce, but then they're also losing returns to experience, and that really widens the gender wage gap. But then again, coming back to this silver lining, this possible change in social norms, I wanted to highlight this quote here. This is an email one of my co-authors actually got from a person who read about our research in the newspaper. And I thought this kind of showcases nicely this potential, role for or potential change in social norms. So she wrote, "I just wanted to say I was excited to see your paper. My husband is a dentist who was never much involved with the kids or domestic activities and has transformed to a stay-at-home dad for the past 5 weeks while I continue to work from home. The effect on our family has been profound and life-changing, and it would have never happened without a global pandemic." So this is just an anecdote, just one person, but we do see in the data there are quite a few dads who are suddenly on the playground, or especially last spring. And this is also happening in our model. In the model, the fraction of couples where the husband is the main childcare provider, that's the red line, actually goes up over time. And that, I know I'm pretty much out of time, so just give me one more minute. This can have long-run beneficial effects for working mothers in the long run. So here I'm plotting, these are the same kind of pictures, but now thinking about 50 years down the road, rather than just 20 quarters, as I showed you before. And even though it goes down in the pandemic, the relative labor supply, the relative hours worked for women over men, after a while, it catches back up to normal, and then it overshoots. And the overshooting is due to these assumptions on the higher fraction of people who can telecommute, freeing up time, both of the mothers and the fathers helping more too, and also this assumption of the social norms. In fact, each one of them separately would lead to this increase in hours worked of mothers or of women more generally in the long run. It's not huge, the effect, though, I should say. And then in the very long run, in fact, it would lower the gender wage gap, actually. So there could be a possible beneficial effect, but here in our simulation, that takes a long time. So only after 20 years, we're back to normal. And then, it takes another 20 years to really overshoot. School reopenings are quite effective countermeasures to the pandemic. So Alessandro just showed us schools are very important in the pandemic itself, but the costs of the closed schools in terms of the economic costs are also very large. So if we could reopen them more quickly, that could lead to a quicker recovery possibly, is what our model shows here. And that could reduce the gender wage gap also more quickly, possibly. So let me just conclude by saying that the pandemic recession leads to much larger employment losses, as well as hours reductions for women relative to men for multiple reasons, as I've shown you both in the data and in the model. And this really matters for the evolution of gender equality. It matters for the gender wage gap, for example. it matters for policy. So in terms of schools are not just important for children's learning losses. That's been widely discussed all over the place, but they're also very important as sort of enabling labor supply. And then last point, just something to think about, it may in fact matter for the recovery. So I've been reading some recent, at least newspaper accounts that vacancies seem to be currently hard to fill in the United States. Possibly some of that might be actually because childcare is still to some extent unreliable. And because of that, women are reluctant to go back to work. Yeah, that's it. Thank you.
Thank you, Michelle. So questions are piling up as you guys have been talking. Let me start, let me go a little bit back because some questions came up during Alessandra's talk. You had mentioned Minnesota and Wisconsin, and one of the questions was they've had similar outcomes. So the question from Bonnie is, so why did Minnesota and Wisconsin have similar outcomes if they had different policies?
Yeah, that's a great question. And I was using this as an example of how, you may have different policies and get the same outcomes, and maybe you cannot conclude that, the policies are ineffective simply because you observe the same outcomes. Why? Because you may have underlying differences that you have not considered when making this comparison. And while I've not, studied specifically all the possible sources of heterogeneity, why Minnesota is different from Wisconsin, things that are important for the infection spread are, for example, the demographic structure, and how many old people there are in a different states, or how many, different ways of interaction you may have. And people have said that Wisconsin looks pretty similar to Minnesota in terms of demographic structure, industrial structure. So my guess, but this is a conjecture, is that, for example, maybe also due to the fact that Minnesota has a very important international airport. And one thing that I know is that the variants have been much more able to appear in Minnesota earlier on, like the UK variant, which is much more spreading and highly contagious, and so on. That could be another important reason why you may have more spreading in one. Without the policy, you would be, observing more spreading in Minnesota than in Wisconsin, and just you don't know. And sometimes, the fact itself that the policy has been introduced is the symptom that there was some vulnerability in that state, and that could be, something to think about. So while we cannot be sure, of why, we observe the same outcomes even with different policies, we also, all I'm saying is that we also cannot be sure that that means the policy is ineffective. So you cannot conclude that the policy is ineffective, and but at the same time, more work needs to be done to see what exactly the effect of the policy would have been in the counterfactual, and that's what the model would be useful for. And the model with the interactions, for example, with a major hub airport, will actually help, in thinking about these issues.
So both of you mentioned school closures, and a question comes in from Simona, who I can recognize from the last name as another of our former alums. She's asking about school closures. Networking seems different for university students and elementary school students, fewer parties, for example. Does this mean school closure policies should be differentiated? Both of you can take a stab at that one.
I would say absolutely, for many different reasons, in fact. I mean, we know by now the spread, even for the same contact matrix, I think the kindergarten kids, for example, spread the disease very differently from student age people. That's one. And then, yeah, students, if you think about lectures, we sometimes teach with, 1,000 students in the room is, again, very different from even a high school. So I think absolutely it needs to be differentiated.
Yeah, I would just say, from what Michelle shows us, that's a very important also for parents, labor supply. So if you have your kid in college, it's a very different than if you have your kid sitting next to you while you try to work. But also, one thing that, for example, we notice, again, going back to the interaction of different policies, one thing has been noticed in Italy, for example, has been the important role played by public transportation. So another important issue is to think about not just the school, but also all, the connections that may happen together with the school. Because it's the public transportation in Italy have been, a huge vehicle of transmission. It was not just the school, but so the college will have a different dynamics, will not have to interact with the public transportation, or it will not have to interact with the labor supply of women. So all these are important considerations, and you cannot isolate, one piece of the economy from the rest. And in that sense, it's important to consider the whole economy at once.
Also, if I can add one more piece to that. So I just saw a recent study on actually using data from Texas, and they found the school closures were quite effective in reducing the spread, but the channels are not quite as what you'd expect. And they found most of the channel was through changes in the behavior of the adults. So the closed schools kept the kids at home and kept the parents at home as well. So there was much less mobility to the workplace. That was one of the effects. But also parents reduced their leisure activities. So it seems it acted almost like a signal as well about the severity of the situation. And I think that's also something important to keep in mind. It might work, but if it works to these other channels, maybe that can be achieved in a different way, without hurting the kids as much, right? If the schools, the direct network effect of especially for the elementary schools, not that large, and it's all these indirect channels, maybe that could be achieved differently then.
So let me do a follow-up on that, and then I'll go back to a couple of others. We're going to have a pandemic again in our future, very likely. If you guys were, on Fauci's team, what would be well, maybe not Fauci because he's doing the epidemiology, but on the economics team, what would be the number one, say, lesson transmitted to the policymakers from your findings? Will be the number one thing, like, don't do it this way, or we did it really great that way, let's do it again. What would be the number one thing you would tell them?
Yeah, that's a tough question.
I mean, one thing we have not talked about today that I feel is important, so somehow I want to give, a little bit of relevance to that, is also the inequality piece, because one thing that worries me is also that, the different sectors are also populated by different kind of workers and different segment of society. And one thing that has been happening is that the poor people and the ones that cannot afford to, lose their jobs, or to send, or, to have internet for their kids, or that are essential workers that need to risk their lives, those people are in a very different spot. And somehow these pandemics and these policies have, exacerbated some of these differences. So there is also a long-term piece that today we have not, we touched to, but we haven't really explored. And for that reason, I think that, thinking about how to use policies that mitigate but do not close completely the economy is really important, because the costs of closing the economy are really not bared equally. So.
Yeah, I would agree with that. The one other thing I would add is I think we've really learned over the course of the last year that this voluntary social distancing does work quite well. It doesn't mean we don't need any policies beyond that. I'm not saying that, but all the projections made by epidemiologists without taking any of this voluntary cautious behavior into account were also completely wrong. I mean, if you look at Sweden, for example, a country that didn't impose many lockdown policies, it didn't go through the roof. Yes, they had higher numbers than Finland and Denmark, but not crazy numbers either. So if we evaluate policies, we have to be super careful to, what's the counterfactual. we cannot evaluate the benefit relative to, you know, these crazy predictions that didn't happen anywhere. And so we have to, but exactly what does it mean? What would have been the right policy? And have we maybe overdone it in some countries? I don't feel quite comfortable making a final judgment on that yet.
So we also got a question from Sally, who wants to know, why is India so bad?
I mean, I think there are, you know, like, I didn't study India, so again, this is conjecture, but what we understand is that there is a particularly, one thing that also we have in the model in background, especially with in my work with Laura Welcome, is you can have these mutations, you know, germs, the more they spread, the more they also change. And when they change, you know, they become a more highly transmissible, more contagious, sometimes even more deadly. And so that happens, probably has happened in India. That's what we hear. And on the other hand, they also did not vaccinate much the population. So you have at the same time, you know, this low vaccination rate and this very contagious variant going on, and a very dense population that also has a lot of social interactions. You know, people have been talking about how some of the religious meetings and gatherings have been a big spreading events. So there are at least three pieces going on at the same time. Usually it's more complicated than just one single element. But the hope is that another thing that we learn from that is that we are all in this together. That it's important also to think about what's going on, you know, in the other countries and trying to get, you know, vaccines available for the largest possible share of the population, because the virus is, you know, spreading, but also changing the more it spreads. So it's everybody's, you know, we are all in this together. It's everybody's job to try to keep it under control.
So to Michelle, one thing interesting about India is how low their labor force participation is amongst women. What are your thoughts?
So the question is about not just during the pandemic.
Well, what would you, I know you studied the US, but in India, women, even pre-pandemic, are not in the labor force.
Yeah, so I mean, female labor force participation rates differ widely across countries and also historically. So I don't know the exact numbers for India right now, but many developing countries have, or even historically in the United States, you know, it used to be much lower, and that has many different reasons, gender wage gap being one of them, division of labor in the household, but some of it is also measurement to what, you know, especially in poor countries, some, you know, the distinction between market at work and sort of home production at some point gets kind of blurry. How are we counting it? If women are just selling some produce on the market, is that counted as a labor force? Probably not, but they're still earning some income. Yeah, but Alessandra has also worked on the topic. I don't know if you want to pitch in or have any specific thoughts on India.
It's a good topic for a future thesis. What do you guys think? I have one last question in the box from Jorge. Could the network effects capture the plateauing in the realized infection rates?
Of course,
very
great
likely.
Point.
Very likely point.
Great point. It's coming from an economist. Yes, that's exactly the, you know, thank you for asking this question, because it gives me opportunity to clarify a little bit something that is not obvious from the model. That is, if you have a bubble, you know, in one side of the network, it could be that the infection spreads in the bubble, but never gets out of there. And so it may eventually die and never go all around, you know, the network. So having a network model also helps understanding, you know, how, you know, the instances in which the epidemics may never really take off and never spread. And I think it could be that by using models that didn't have this feature at the very beginning of the pandemics, we sort of predicted in some ways the epidemics. I remember a year ago, you know, numbers that were really, you know, somehow over predicting how much the infection would have spread, and so may have led, to overdoing policies too. So I think, that's a very good point, and thank you for the question.
Well, we're at our ending point of 110. And I want to thank Michelle and Alessandra for first sharing your research with us and taking questions from the audience. I also want to mention to the group that next week, we're going to hear from our undergraduate, I call them our HHEI scholars, our undergraduates who work with the faculty as research assistants, and they're going to present their work on May 19th, same time, same place. Thanks, everyone, and thanks especially to Alessandra and Michelle.
Thank you for having me.
Thank you, Ellen. It was really nice. Thank you for the opportunity. And bye, everyone.